So I have got a standalone cosmetic clinic in Melbourne. I started the clinic with Dr. Nick Kimmins, who's also a skin cancer doctor, and he's my business partner. And we sort of came to it from slightly different backgrounds. So Nick's a partner in 2 general practices. The main one is the Bluff Road Medical Centre. It's been there for more than 30 years. They now have 21 doctors, more than sort of 10 full-time equivalents. They've been doing skin cancer screening for 10 or 11 years. And when I first started next to the Bluff Road Medical Centre, they had 2 full-time GPs who were doing part-time skin cancer. They've now got 5 doctors, including myself, who are doing skin cancer medicine there, although most of us are doing it in a part-time capacity, but the 2 full-time doctors are probably doing 60 to 70% skin cancer medicine. They've got a second practice, Bayside Family Medical Centre, which is 2 suburbs away. There's 6 doctors there. It's also been around for more than 30 years. Nick had an interest in aesthetics and had been looking at doing aesthetics for a long time, but was sort of in that space where he was doing general practice and doing skin cancer medicine and sort of didn't quite know what the next step was for him. My story is a little bit different. I did general practice for many years and I was a partner in 2 fairly big general practices in metropolitan Melbourne. But how my journey started is actually a little bit different. When I was in my late 30s, I developed this little lump right in the middle of my forehead. It looked like I had a third eye. And I had a look at it. I didn't know what it was. I thought, oh, I put some creams and things on it. It didn't go away. I showed it to one of the other experienced doctors in the practice. He said, oh, it's a pimple or a cyst. He stuck a needle in it, tried to squeeze it out. Nothing happened. Took a week or 2 for that to get better. It was still there. It was getting bigger. So I showed it to one of the other experienced doctors in the practice. So this was probably 2005, 2006. And he said, oh, I don't know what it is, but I'm just going to freeze it with some liquid nitrogen and that'll get rid of it. I went, okay. So he froze it for me, got a blister, got a scab. Scab came off, still there, still getting bigger. So I showed it to my brother-in-law, who's a plastic surgeon. And he said, oh, I don't know what it is, but I'm going to cut that out. So he cut it out for me and it was a squamous cell carcinoma. So we're all a little bit surprised by that, including myself. And at that stage, as I said, I was in my late 30s. So I thought, I need to do something about my sun damage. So that sort of started me down a journey, looking at, well, what can I do to improve my skin? And what do I need to do because I've already had a skin cancer on my face in my 30s? So that started me down this route. So I was still doing general practice, and in 2005, I started doing some injectable training. So I started doing some training in Botox and fillers, and I was doing that in my general practice. In 2007, or it might have even been 2006, I did a health cert skin cancer medicine course, and that started me into doing some skin cancer work. I've been working as what we call a cosmetic physician since 2007. So I evolved from doing some part-time injectables in my general practice and some part-time skin cancer medicine, and I actually went and did some part-time work in a dedicated cosmetic clinic, and I was very lucky that I was mentored there by an experienced cosmetic physician who had an interest in lasers and had purchased over a number of years about 15 different lasers. So I got fantastic experience and fantastic exposure to lots of different lasers for lots of different conditions. And I also did some part-time work for a dermatologist and again was exposed to those sorts of things. So when Nick approached me a number of years ago and said, well, I'm interested in aesthetic medicine and we've got some space in a building next door to our general practice, what do you think, do you think, can you see yourself in a clinic there? So that was how our clinic was born. And luckily for me, the clinic's in Sandringham. I live in Hampton, which is literally less than 5 minutes down the road. So this is the building that we practice out of. This is my consulting room. So as you can see, it looks a little bit different to your sort of standard general practice or skin cancer consulting room. It's a little bit more aesthetically pleasing. When we started, what we did was we sat down and had a discussion and said, well, what is it that we want to do here? Because I'd worked in general practice, I worked in a skin cancer clinic, I'd worked in a dedicated cosmetic clinic, but I'd also done some work for a dermatologist who did aesthetics. I had some sort of ideas about what I wanted to do and what my interests were. And my main interest, because of my skin cancer focus, was treating sun-damaged skin. So what we wanted to do was set ourselves apart and not be sort of the beauty therapy that dabbled in injectables on the corner. We wanted to be a medical clinic that took a medical approach but to treating cosmetic concerns. So our mission statement in 2012 when we started was to provide a credible medical, cosmetic and laser alternative. We wanted to provide holistic care for all skin conditions, but we also wanted to service the local community. I live in the local community. Nick, my business partner, lives in the local community. We're in a bayside suburb of Melbourne. We're near the beach. It's a very sun-damaged area. One of our other aims was, we wanted to enjoy it. I mean, obviously income was important, but for me it was more about doing something that I enjoyed, because I'd got to the stage where I was not enjoying doing general practice, and that's why I ultimately left general practice. We feel like we've achieved our mission statement. We're always trying to do better. We're always trying to provide more services, and we do a lot of training and professional development for our staff. And I've just put down there, we're still learning. Aesthetic medicine is changing all the time. New devices come out. There's always new treatments and new techniques around. So as I said, we formed in January 2012. Initially, we were in a very limited space. So the building that we went into, which is next door to the Bluff Road Medical Centre, is an old converted house, as a lot of general practices used to be. But the front of the building was a radiology clinic. It was leased to radiology for a number of years. And the back of the building had just been administration, and I think a physio was using one of the rooms. So when we first started, this was the space we went into. We put a wall up there, and that was our reception. That was my consulting room, and I did injectables in there. And this larger room became our dedicated laser room. And we employed a dermal therapist, and we bought a laser. So when we started, that was really all we did. So that was in 2012. In 2014, we subleased the larger sort of waiting area from the radiology practice, and that then allowed us to turn our reception area into a second room where we put in an LED machine and we do PDT and that sort of thing in there. And then in 2016, we were actually given the opportunity to lease the whole building. So now we're in the whole building, and that allowed us to increase our space. When we were looking at starting out, we did a little bit of research. So in our suburb, there was an absence of medical aesthetics, and there certainly wasn't a laser practice in our suburb. We had some competitors. We're very well serviced for plastic surgeons in our area in Brighton, which is a fairly affluent suburb of Melbourne. A couple of kilometres away, there's 5 or 6 plastic surgeons. There was a dermatologist who was doing some laser about 7 kilometres away, but he decided laser wasn't his focus. He does Mohs surgery, so he actually sends all his laser patients to us now, and he's been a very good referral source for us. There's a few GPs scattered around who do a little bit of aesthetics. There was a beautician in Sandringham and another beautician in Blackrock who were doing some laser hair removal, but that was really all the competition that we had. So we saw that there was a sort of space in our area for a higher grade laser and aesthetic service. Now, things have changed. There's more medical and non-medical aesthetic businesses around us. There's 2 dermatology practices. Initially, they weren't doing any aesthetics, but they are now doing a small amount of aesthetics. There's 3 cosmetic clinics nearby. There's one in the next suburb, there's one in Brighton, and there's one in another suburb, Beaumaris, that's not far from us. So, we went from really being the only clinic of our type to, there's now quite a few around us. And we are probably only 2 kilometres from a major shopping centre, and in that major shopping centre there are now 3 chain cosmetic clinics. So we've got a lot of competition now. Just getting back to that point, with the competition, we have actually found that that's been good for our business. There's more awareness of these sort of services. There's more people looking at where do I go for these sort of services. And we actually find that the increased awareness means that people find us more easily because they're doing Google searches and that sort of stuff. So competition isn't necessarily a bad thing. When we started, we had to say, well, how are we going to get our patients? And so what we did was we used the database of the general practice next door. So as I said, Nick, my business partner, who works in the general practice next door, had been doing skin cancer medicine there for, I think, 6 or 7 years by the time we started, and he had a database of, you know, more than 1,000 patients who'd had a skin check with him. And I don't know if you found this in your own practices, but when people come for a skin check and perhaps they've got a big solar lentigo on their cheek and you look at that and you say, no, that's fine, it's a sunspot or it's sun damage, but they say, well, that's great, but how do I get rid of it? So that sort of evolved into us, you know, getting a lot of patients through the general practice and through the skin cancer side of things. With the Bluff Road Medical Centre, which is next door to us, as I said, they've got a lot of doctors. They've got quite a few skin cancer doctors. It's a private billing practice. Most of the patients in our area have got private insurance. So it's a fairly affluent area, and as I said, it's close to the beach. So what we found was that of all the thousands of patients on their database, the skin cancer patients were saying, well, how do I treat my pigment and how do I treat my redness? So we sort of set ourselves up initially as a bit of a what I like to call a red-brown clinic, and I was doing some injectables as well. We gave some talks to the general practitioners next door, and you know, we got some friends and some family in. We gave them free or discounted treatments just to get the word out there that we were there. What we didn't do though was we didn't spend a lot of money on advertising because we had this dedicated database of patients already next door to us. And when we started, we were only there 2 or 3 days a week. Thanks, Kelly. So we started with myself. We got a dermal therapist. A dermal therapist is a university-trained dermal clinician. They're trained how to do IPL, laser, peel, skin treatments, and this was a dermal therapist that was known to us and had previously worked for a plastic surgeon. She had worked with a machine called Cutera Zeo, which is a platform device that does vascular treatments. It does IPL for pigment and vascular, and you can buy all these attachments for it. So you can buy an attachment that does hair removal, and you can buy an attachment that does resurfacing, and you can buy a skin tightening attachment. So that was pretty much the only device that we had when we started. We employed a receptionist from the general practice next door who had an interest in our area. So there was really just Nick and myself, a dermal therapist and a receptionist when we started. Now we've actually got 3 dermal therapists, although one is on maternity leave at the moment. We have a cosmetic tattooist who comes and visits the practice. We've got a full-time nurse who I had previously worked with in another cosmetic clinic, who was a theatre nurse, but learned how to do IPL and laser, and we've now trained her up to do injectables. We employed a second doctor who's a very experienced injector, and we've recently just employed another doctor who I am mentoring, and she's been trained in injectables, and she's also being trained in laser and those sorts of things. So, you know, the practice is getting quite big now. This is the equipment we started with, pretty basic. So a microdermabrasion machine, we did peels, I was already doing injectables, we sell cosmeceutical skincare, some mineral makeup, and as I said, we just had the Cutera Zeo, and those were the attachments we had. We were actually very lucky in that we were offered a second Cutera Zeo second-hand a couple of years later, and we jumped at the chance to buy it because it was cheap, because our original machine cost us $165,000. So the second one was much cheaper than that, and we'd been really happy with the first one. So, and we sort of saw the need for a new device. This was the sort of stuff we started out treating, you know, vascular conditions like this. This older guy's a sailor, so you can see you can clear up vessels pretty well. You know, this is the typical sort of, you know, dyschromia, sun damage. So this lady had a couple of epithelial ablation therapies, which is really good at clearing up the surface of the skin. So that was sort of our demographic that we were treating originally. We now have a laser called Photona SP Dynamis that does erbium laser resurfacing, and it does laser skin tightening. It also has vaginal rejuvenation mode. So we now have a gynecologist that comes to the practice once a fortnight and does vaginal assessments and does the vaginal laser for people who need that. I forgot to mention we've also got another device which is a radiofrequency device. It does a thing called fractionated microneedling radiofrequency, which is skin rejuvenation and tightening. We do Chloresca, which is a biophotonic acne treatment. In fact, we were the first non-dermatology practice in Australia to start doing Chloresca. We've got Cooltech, which is a cryolipolysis machine. We've got a dedicated pigment laser now, a Q-switch laser that does tattoo removal as well, but it's fantastic for zapping off lentigines and that sort of thing. We've recently purchased an ultraformer, which is high-intensity focused ultrasound, so that's non-surgical lifting, and we've recently bought a plasma jet, which does non-surgical blepharoplasty, so we've got a lot of equipment now. I also do cosmetic mole removal with a little radio frequency machine. These are the sort of results that we can get. So this is our radio frequency machine. This is a patient in her 40s who had 4 of the microneedling radio frequency treatments. These are the sort of results that we're getting from our Cooltech machine. So we now treat a big sort of demographic of different conditions. I will just mention very briefly, we tried not to spend a lot of money on marketing and advertising when we started because we'd spent a lot of money on a laser and we'd taken a bit of a punt on that. My advice is if you're thinking of getting into this area, do not buy a laser unless you've spoken to a doctor who uses it. You know, laser salesmen will tell you all sorts of things, but you really need to be using a laser or know somebody who uses a laser before you spend a lot of money. But we were lucky that we'd already had experience with the laser. These are just some of the other things you need to think about. I have run out of time, so I won't really go through this, but we did a lot of marketing to our local community. We found that things like radio advertising, newspaper advertising, that sort of stuff, it just didn't work for us. So we go very much with the word of mouth and trying to get the word out there to sort of local practitioners about the sort of stuff that we do. Because a lot of people, when they hear cosmetic clinic, they think of, you know, overblown lips and too much Botox, and that's sort of the opposite of what we're doing. I won't go through our website. If you feel free to have a look at my website and sign up to my social media channels. And these are just some of the photos of what our clinic looks like now. These are our treatment rooms. These are that's our Cutera Zeo. This is Dawn, one of our dermal therapists. This is one of my children. This is our Cooltech machine that does the cryolipolysis. We bought this nearly 2 years ago now, and it's exploding, that whole fat reduction market. It's been very profitable for us. This is Kristen, who's one of our other doctors. She's a very experienced cosmetic injector. And this is just some of the treatments that we do, and these are all images off our website. So we've evolved from this sort of small medical grade cosmetic clinic, mainly doing sort of laser treatments and a little bit of injectables, and we are now sort of encompassing nearly every aspect of non-surgical medicine. And we've done that probably in 6 or 7 years. And from my personal point of view, it's actually been very rewarding. For me, you know, I enjoy the work that I do. I never sort of go to work thinking, oh, I've got a busy day today, I'm not looking forward to it. You know, you develop a real bond with your patients. So, you know, it's actually a very good adjunct if you're already treating sun-damaged skin. Even if you just go into it in a small way, it's actually a very good adjunct to a skin cancer practice. And these are just some of the room requirements you might need. I assume a lot of you have already got imaging. The one thing that I want to leave you with is, as I said before, you know, we now have a lot of competition, but I would encourage you that if you're going to get into this space, do not discount. We're doctors doing this sort of medicine, and there's a lot of non-doctors out there doing these type of treatments, and we differentiate ourselves by the fact that all of our staff are university trained. All of the assessments are done by, you know, usually a medico on the staff before we recommend a course of laser treatment. So don't try and differentiate yourself on price. It's just a race to the bottom. And then, so what we say is we provide a premium service so that we can charge a premium fee. Thanks.